Do you find that most people just aren't sticking to the fundamentals of what health is about, right? Like
Yeah.
those fundamentals of connectedness, nature, breathing, sun, relationships, sleep. Everyone's running out and just being like, just give me the drug,
Yeah.
right? Which is
Yeah.
so non-fundamental, non even essential. But we've kind of got it backwards where we go to that first instead of going to those fundamentals, like going in the gym and doing some really strange little workout, like only like Mr. Olympia is like do instead of just squats and like do a little running or moving or anything like that. Is that what you're seeing?
Of course. I mean,
Yeah.
we as Westerners, we live in a very fast-paced society. Since the pandemic, everything has escalated. I'd say 4 to 5 times in terms of the speed. I mean, this year felt like it was 3, 4 months
Yeah.
compared to years in the past. And when you look at it, you got work, you got kids, you got, projects, you got passions, you have fun you're trying to have, you're trying to travel, enjoy life. And it's easier to just pick up a pill and, take that every day than it is to go to the gym, to go sit in sun, to go take 10 minutes and meditate. Most people can't even turn off their brains, right? It's like, I'm trying to meditate and I can't. It's like, well, of course you can't, because you're worried about everything else. And that's part of what meditation gets you out of, right? But it's a lot easier to fix short-term or long-term situations with a short-term solution. And those short-term solutions are just band-aids. It's not a lifestyle, right? And for me, I've even had to go back to the drawing board and say, Brett, what do you have to do every single day to be able to live this life that you want to live? And it all starts with having a game plan, just like it started in football.
Mhm. It seems like when I speak with athletes a lot, they get a lot out of the structure that comes with the athletic sport and all the training and everything, but they also get a good amount of command of their life and understanding that there are some sacrifices that need to be done to get to where you are. Do you feel in general that we've kind of given up? Like, it's something I know Darren Olian is called like fatal conveniences.
Mm.
It's really easy to do like the unhealthy thing.
Yep.
But if you're already ingrained in you, like, hey, the way to get ahead is like, you got to train, you got to wake up early, you got to push yourself, you got to be, completely dedicated to the sport to excel.
Yeah.
And then you just transition that to life and everything else you do. And it seems that athletes have at least a better chance almost at this level of success in other things as well. Do you feel that we've just made life too convenient and we avoid kind of the things that we know will give us kind of the level of success that we sometimes really ache for?
Well, Casper, I mean, when you look at, your phone and you pick it up and you say, what am I going to eat today? And you can literally Postmate or Grubhub it and have it there in 45 minutes. I mean, that's the life of convenience. That is
Yeah.
literally what we're doing right now with our lives. We're making it as convenient and as easy as possible, because in a lot of ways in business, it's optimization, right?
Yes.
It's how do I do more with less? How do I create more time, free up the things that I want to do? And it's like, okay, cool. You just made your life extremely simple, extremely easy and streamlined, but yet you're still not doing the things that are required, the hard things that are required to get you to emotionally change, to get you to mentally shift, to get you to build new habits and routines. And that's the structure that football gives you at a very young age. Is like, I know I got to show up for practice. I know I got to listen to what the coach is going to say. I know it's not going to be easy, and I know I'm going to have to push through this, right? I'm probably going to have to hit some people really, really hard so I don't, so I'm not taking the bruit of the butt, so it's like, there's a lot that goes into it, from the physicality to the mental, but it's really all mental. I have a youth training academy that I train youth high school football players, and in everything that I talk about is mental. Everything that I see them do on and off the field is mental. And I'm constantly belaboring, you got to do everything right, because how you do one thing is how you do everything. And I know that that's a very cliche saying, but we've heard it time and time again because it works. So, right, how you wash the dishes is the same way as how you play football, and how you play football is the same way you get into business. So if you're selfish on the football field, when you start running a company, you're going to be selfish to your employees.
Mm. Yeah, it all transitions there. And it is true. I see it so much in medicine that people just want the kind of the physical answers to things, but they refuse to touch on the mental, emotional, and they get almost upset because they think you're saying it's in your head. It's not that. And it is in some ways, meaning
Sure.
the disease is not in your head. The disease is real, but it starts in your head.
Yeah.
And that's where people kind of, mistake that. It's not to say you're making up the disease. No, you're creating the disease.